All right.
Hi, everybody. Welcome and good morning, everyone. Happy Friday. My name is Rita Young, and I am here today with Jeff Thompson, and we're going to be talking about the NowComp waiver selection. So, if you are out there, it looks like a few folks are joining us. Let me know. So, folks are watching in a private Facebook group that I have called Real Talk with Rita and on YouTube. So, we're live in two places. This is an online community for families, for providers, and other DD professionals to talk and talk about how we support our adults with developmental disabilities. So that is the focus of this group. And today, our conversation is going to be focused on selecting those folks that are on the planning list, how they actually get services. And so, as folks are joining us, let me know you're out there. I won't start until I know folks are out there and can see us and can hear us. So in the chat, let me know. Can you hear me? Can you see me? And tell us where you're watching from as well. Folks are just now starting to join us, Jeff. So I'm going to give that just a little bit of time. In the meantime, just to let you know, if you're watching on YouTube, I can see your name and I can give you a shout out. If you're watching on Facebook, if you will give StreamYard permission to sync up with Facebook, I can see who you are. If not, it'll just come through as your comment. So folks are watching us. We have Rock Spring, Georgia. Valdosta. Hello, Valdosta. Okay, Decatur. Good morning, Todd. So that's great to know. Others. Okay, so folks are just starting to join. So I'm going to go a little bit slowly at the beginning. We have with us Jeff Thompson, who is the Director of Community Services for the Division of Developmental Disabilities, which, as you know, is part of the Georgia Department of Behavioral Health and Developmental Disabilities. Good morning from Briggs and Associates. Good morning from Lawrenceville. Thank you all for joining us. We're just getting warmed up and started. People are just starting to enter the chat. I will also let you know that Tawanda Stamps will be joining us a little bit later. We'll tell you who she is and how she plays a part in this picture in just a bit. Fayetteville, welcome. Locust Grove, welcome. So we are from Decula, and I hope I say Decula right. I never know if I say it correctly or not. So you let me know, Sandy. So we're here talking about waivers, Medicaid waivers, the now comp waivers here in Georgia, and how that process of you're on the planning list, how do you move to actually getting the now comp waiver services. All right, so we're going to go ahead. Thank you, Sandy. I appreciate that. All right, so again, my name is Rita Young. I am a private consultant, and I'm also a parent. I have two adult sons that are autistic, and my oldest will be 30 this year. I cannot believe I am saying that, but yes. So, and also if you're a family member, let us know how long you have been on this journey. I've been on this journey for many years. Hello, Savannah. Good morning, Powder Springs. So folks are continuing to enter the room. Hello, Tina. Good to see you. Thank you so much for supporting, Tina from Lithonia. Anyone else want to let us know where they are from or how long you've been on this journey? I mentioned I'm almost 30 years. It's a long journey, folks. But I always say, if anyone wants to study what resilience is, right, they could study parents of children with developmental disabilities, right? That's my personal opinion. All right. You are welcome, Jose. It's good to see you. Box Springs. So, from Treon, Georgia, I hope I said that correct. Your adult daughter is 38 and has her own business. Bravo. I need to interview you. Good morning, Bob. 43 years. Okay, so you've got me beat. Your daughter is 21 and you've been on the planning list for 12 years. I'm so glad you're here, Sandy. So glad. Okay, so we are going to go ahead and start this morning. Folks will continue to join us, so continue to comment and let us know where you're from, how long you've been on the journey if you're a family member. We're going to go ahead and get started. So, our interview today again is with Jeff Thompson, the Director of Community Services for the Division of Developmental Disabilities. So, welcome, Jeff. Thank you for being here today.
Thank you. I really appreciate it. So, to start with, if it's all right, I'll describe a little bit about the role I'm in now and what my team's responsible for.
Absolutely. So, what I'd love for you to know, to tell us about, is your role recently changed, and we're going to have the person that replaced you in that role on with us a little bit later. So, please tell us, yes, about your current role, your previous role. Absolutely, jump right in.
Terrific. Thank you, Rita. And thank you for having me today. And I'm really excited that so many people are interested in this material. The more people that know how things work, the better. So thank you. So right now, my team is responsible for supporting family support services, participant direction, support coordination, and supported employment. But up until about 6 months ago, I was a statewide admission services manager. And in that role, my team was responsible for the planning list, which I'm pretty sure is why I'm here this morning.
Absolutely. Yes, absolutely. So, you are a subject matter expert in what we call the planning list here in Georgia. And again, your role has changed, and congratulations on your new role.
Thank you.
So, we are here because as of July 1, there was tremendous advocacy this year. 513 new Now Comp waiver slots in Georgia will be available for individuals with intellectual and developmental disabilities as of July 1. And so, there's again a lot of questions, I'm sure, about eligibility. And if you do have questions on eligibility, I have an interview with Dr. Kelly Bishop, and she's the Director of Eligibility for the division. So I encourage you to watch that rather. So today we're going to be talking about those waiver slots, how folks are selected. Okay. So we have regions in Georgia as well, right? So 513, and I know that you're telling us to the best of your ability. How will those be divided? Are they divided by region, or what does that process look like?
Yeah, thanks. So this is a really common question that we get, and it's helpful to explain it to anyone who will listen, to be honest. So some states, when they're doing their planning list and awarding waivers, they do it by how long you've been on the list. And that is not how we do it in Georgia. In Georgia, we award waiver service entry based on level of unmet need. And so the waiver spots will not be divided up by region because it's prioritized based on unmet need and some specific life events that could create a crisis. These will be awarded around the state based on level of need. And so we assume that level of unmet need and crisis happen the same everywhere, right? And so these waiver slots or spots will be divided roughly based on population size. And that's only because people's conditions are similar regardless of where you are. If you're in a town of 100 people versus 100,000 people, it makes sense that a larger number, but the same proportion of people would need services in each of those places, right? The population of 100 would probably get very few, and the population of 100,000 would probably get considerably more.
Okay. So, and how are families notified about their place on the waiting list, or on the planning list, rather?
Yeah, thanks. If we awarded waiver services based on length of time, then it would make perfect sense that we could say, of the 7,140 people who are on the planning list at the beginning of this month, you are number 3,217. But because it's based on level of unmet need, there's less value in saying at this specific moment, you're number whatever, 300. Because at any moment in the day or night, at any point, people's needs can change. And so while you might be 7,139 on the list right now, meaning basically all of your needs are met, and you're just on the planning list for futures planning, which we do have a number of folks. A parent can pass away, there can be a medical crisis, and you can move immediately to the front of that list. And so it seems disingenuous to tell someone right this second you are this number on the planning list when that's not really, that doesn't match how we operate, because it can change at any point.
Okay, so, and we have in our state support coordinators that act as communication tools for individuals that are on the planning list, correct? So, and
So
yeah,
Rita, if I can correct that a little bit, we have
sure.
support coordinators in the state. We have support coordination agencies who provide a waiver service, which is support coordination. And so once you have waiver services, either now or comp, you'll have a support coordinator. But while you're on the planning list, you don't have any type of support coordination.
Okay.
DBHDD manages the folks who are on the planning list.
So, how is the communication flow then for those folks on the planning list? Do they hear from the region? Do they receive? How do they know? Yeah, how do they receive their communication?
Right. So that makes sense, Rita. Thanks. Following up probably where Kelly left off last time, once someone is determined to be pre-eligible, we have, the regional field offices have 14 days to schedule the first needs assessment. That's kind of broad language. We are almost always able to get them completed before that, but what we have in our procedures is 14 days. And so that first call, and they're done telephonically. The first call, a navigator calls the family and says, hey, your child or you have been determined to be pre-eligible. They have a conversation about what that means, and then they complete the needs assessment. So I don't want to jump around too much because of the way the
Yeah, that's
question
quite
is
all right.
related.
Yeah, that's quite all right. So, you talk about the navigators as well. People may not be familiar with the navigators.
Yeah,
Can you tell us a little bit about their role?
I sure can. Thanks. So back 4.5, 5 years ago, we redesigned how our planning list works and how we move people into waiver services. It used to be set up so that each person on the planning list had a planning list administrator assigned to them, which is probably similar to what the thoughts were about support coordination. But that planning list administrator, we call them PLAs, would go from family to family to family, and in some cases, 80 families, 100 families, and check in on them. And what we found was that wasn't the most effective way to do our work, because if you have to check in with 100 families in a month, there's not a whole lot of time left for those people who are moving forward into waiver services to do that work. And so we created a new role and chose particular planning list administrators who have excelled at this, to complete these needs assessments and to manage the folks who are on the planning list. The remaining PLAs, now their only job is to move people forward into services. So once you've been identified to move into services, you'll be assigned to a planning list administrator. They have caseloads of about 25 now, and they're much more effective in moving people into services. And in fact, since this change, the number of people that the average PLA is able to move into services has increased by 50%. So,
Okay. Okay. So that's good to know. So again, we have several families that are on the planning list. And so, talk about what's going to happen this summer and beyond with those 513 waivers. What does that selection process look like? And if someone has had a change, say a caregiver has passed, or maybe they have a health issue, or one of the caregivers has passed, they have a health issue or other extenuating circumstances, how do they communicate that
right.
to
So
those?
that
Yeah.
goes back to to what we talked about, where somebody's situation can change at any moment. And after that initial, so I'll go to our process, and I think that'll answer the question. But after our initial needs assessment is completed, we add them to a spreadsheet. We're really excited. Our case management system at some point in the future is going to be able to run a report, so we won't have to keep up with the spreadsheets. But for now, we still manage with spreadsheets, and we know that we need to call that person back within a year to update the needs assessment. They are intended to be updated at a minimum of annually.
Okay.
And so at any point between those assessments, if there's a significant change, a family or person should call in to the region and say, hey, I need to update my needs assessment, or I need to speak with the navigator. And so at any point there's a change, they should call in, speak with the navigator to update the needs assessment. Okay. Another benefit of this is, so at any of those points where we're updating the needs assessment, if the person's determined that they really don't meet our level of most in need, which I'm super excited about the funding that has come through this year, because the last 2 years, the funding was for sure less. And in those cases, the level of need was pretty high to move forward. And so for those folks who didn't meet that highest level of unmet need, the navigators have access to a number of resources. They're trained to provide references or referrals to a number of different places to assist when we can't.
Okay. And we do have some questions that folks are asking. But okay, so just to clarify, because back in the day, was all different when my sons were younger, very, very different. So if you're on the planning list, are you saying that you should receive a call or a reach out at least once a year?
Right.
Okay.
And so
what happens if you don't? Then what would you do? Call and what's the language we should use? Because sometimes our language as families is different, right?
Absolutely.
So you're saying ask to speak to a navigator?
Ask to speak to a navigator. If you don't remember navigator, say my child's on the planning list and we haven't heard from somebody for a while.
Okay, so Sarah, it looks like that's to your question. I'm hoping that helps. So you call the region, say, I need to speak to a navigator. I'm on the planning list and we haven't heard from you in a while. Something like that. Okay.
Yep.
Okay.
And there are times where either the information in our system, our case management system, isn't accurate, or for whatever reason, somebody may get missed. And it shouldn't happen. We don't want it to ever happen. But if it does, please call. And there are times where we move, right? I moved about 3 years ago. If I had been on a list waiting for support for 10 years and nobody helped me out yet, I wouldn't think, hey, I need to update them that I moved or that I changed my number, right? So please call us so that we can have the most accurate and up-to-date information.
So if we don't hear from the region, then please, as families, be proactive. Call.
Right. Okay. Now, if it's been a month and there haven't been any significant changes, you probably don't need the call. But if it's been close to a year and you haven't heard from us, please call. Or anytime there's a significant change, call.
So Joshua says, what is the number that we call for the yearly check-in? That's going to be depending upon the region that you live in. And I'm not able to do that right now because it would be a little bit too much of logistics on my end. If anyone that's listening could post the link to the regions, that might help. If not, Joshua, I'll put it in later. In the video description, I'll put it in later. Let me just see if I have other questions, if it's okay. All right, here's another one from Cindy. Cindy says, is the planning list those who have been approved but not receiving services?
Right.
Yes.
So if you've been determined to be pre-eligible, and I'm confident Dr. Bishop explained the difference between pre-eligibility and final eligibility, but if you've been determined pre-eligible, then you're on the planning list. And the reason we call it a planning list, sorry to answer something that wasn't asked, But the reason we call it a planning list rather than a waiting list is because we really do have a fairly large number of folks who know at some point their loved one's going to need support, and they want to get everything in so that when that happens, they don't have to worry about finding documentation and getting approval then. So it's for planning.
So Cindy also asked, what does it mean to move forward in services? Is that moving from the planning list to actually receiving the waiver?
That's exactly right.
Okay. Okay. Let me see if I can get any other.
And thanks for the questions.
I'm sorry, Jeff?
No, thanks for the questions, Cindy. I recognize that after you work in a field for a while, the words that come out of my mouth may not mean the same thing. So thanks for the question.
So love the person on Facebook. I can't see who you are, but thank you for posting that link to the regional offices. Thank you, so very helpful. Okay, let's see. All right. Raisa, hello, Raisa. Raisa asks, can you talk about what the current criteria is to be most in need?
Yeah, so the needs assessments that we do are made up of 3 parts. There's the DONR, Determination of Need Revised, which is intended to measure activities of daily living, the level of need someone would have if they were doing that task, and then also the level of unmet need. And so if I were unable to drive to the store, then I would have a very high level of need in that piece. But if my wife was able to go back and forth to the store, then my level of unmet need would be low because the need is met by her going back and forth to the store. So that's throughout activities of daily living. We then have a piece that focuses on medical needs and behavioral needs. So all of these things come up to a score, anywhere from 0, meaning no unmet need. I don't know that I've ever met anyone who would have no unmet needs. And that would include me, you, Rita, and everybody on here.
Sure.
But the range is from 0 to, I never remember what that top score is. The highest I've ever seen someone get is 142, which means very high level of unmet need, significant medical issues, significant behavioral issues, lack of support for activities of daily living. So the other piece that goes into prioritization are those life events that we hope to prevent crises from happening. So say right now you have an unmet need score of 32. That kind of gives you an idea between 0 and 142, if that's the highest I've seen, that 32 is probably not super high. But if your caregiver passes away, we know that's going to change almost immediately, right? Or if you're fairly healthy, but then end up in the hospital because of some new medical challenge, that can make it change significantly. And so we look at specific life events as well as that need score. Frequent involvement with law enforcement. If your family member is on the point of being in a lot of trouble, for reasons beyond their control, that's something that we look at too.
So you talk about the assessments, and someone is asking me to put up another comment, which I will do in a second. But I just want to get to that point. You said the highest is 142. How is the assessment done? Is it a phone interview? Is it virtual? Is it in person? And then after the assessment is completed, can families have a copy of it to verify the results?
Sure. So it is done telephonically. And we started doing this prior to COVID. The assessments were designed to be done telephonically. And so this wasn't a change because of the public health emergency. If a family, for some valid reason, feels that it's important to do this in person, we can make arrangements to do it in person. But they were designed to be done telephonically, which allows us to do the work that we have to do. I mean, there are many of these that have to be done. Oh, sorry. So the next part of your question was, can families get, yeah.
Mhm.
So to get a copy of the needs assessment, families do need to go through DBHDD to do an open records request, and then we'll absolutely send it over. The only thing I would, yes.
So, okay, so that requires an open records request to
Hmm.
receive the okay. That's a whole other, interesting, procedure rather. So, I just find that interesting. Tell us about an open records request and a family member, how they would have to go through constituent services or
Yeah, so
how would they get that?
I believe there's an email that you just email
Okay,
to and state who you are and what you're requesting. And I apologize, I don't know
okay.
the email address, but I believe it's just
Oh,
an email.
okay. I will get that to folks as well, later on, so just give me a little bit of time if that's okay. Um, so talk about the first of all, I'm gonna bring up Robert's point because I don't wanna lose it. It is a valid point. So Robert says, they do you have concerns? They approved more waivers than ever with over 500 from the legislature. So, Robert, I'm certain, well, I'm going to guess you're a provider, but providers can't hire staff. If we don't, yeah. So, talk about that kind of rub with it's wonderful that we have all these waivers, our infrastructure in terms of providers. Are there concerns there?
Absolutely. And thank you for the question, Robert. Before I jump there, though, I do want to mention something about the needs assessments that I think is important. You do the open records request, you get the needs assessment back. It may not, so it's really important to check the information to be sure that it's accurate. But the scoring, unless you've received the training on how to do the tools, the scoring may not make a whole lot of sense to you. And so you can always, if that's the case, though, and you have questions, reach out to the navigator to discuss. So
Okay.
thanks. So back to Robert's question. Absolutely, we have concerns, right? Uh, that's a huge number of waivers. We're really excited about it. In fiscal year 19 or 20, we moved 940 people into waiver services that year. And so I know that we have the capacity to do it. We don't have, and this is internally, and your question is externally, and so I'll get there. I know at the state we have the capacity to do that. For us, it'll still be challenging because we had a reduction in force a few years ago. But I know once we do our piece, do our assessments, and get approval and move them forward, they have to have services, right, to move forward. Yes, that is a huge challenge. There is a workforce shortage. We have Dr. Carol Britton Laws heading up our workforce group, trying to determine the best ways to moderate the challenge. We know that increasing funding, right, will help because then providers will be able to pay more and be more competitive. But a little bit of investigating, we found that that is really not the only challenge, right? We need to be able to have direct support professionals be a career
Mhm.
that's respected, that has adequate training in place, and a pathway to move up, right? To move forward into supervisory positions and the DDP positions. I mean, we recognize there's more than just being able to pay people more. Um, we're looking at, and I don't want to go too far outside my lane here, but we're looking at a lot of different things beyond just increasing wages. Um, Programs through the school systems, training programs, credentialing programs, things like that. Yes, it is absolutely a challenge. Um, the good news, though, is there are between 13 to 14,000 people in waiver services between now and comp right now. And so when we talk about 500 being a huge increase, it is, right? I mean, that's 5 times what we got last year. But when you look at a number like 13,000 and then you add on 500, it's kind of an incremental increase, right? But it is hard just managing what we have now. So you're absolutely right. And that's why we're working on it.
Joshua asks, will the navigator tell us what our unmet needs score is? Thank you, Joshua.
So it's unlikely. You could call back and find out later. So the next piece of the process, once the navigator goes through the needs assessment, it's forwarded to their supervisor to validate it. Once their supervisor validates it, it's sent forward to right now a lead PLA supervisor who has literally decades of experience doing this. That used to come to me, but when I moved to the new role, it made sense for her to do it because, to be honest, if I was on, if I needed more information, she's the person I went to say, hey, let's work through this together. And so now she is responsible for that. And so until we validate the score and make sure it's accurate, we really would prefer the navigator not send that out to you until that piece is done.
So let me just ask from a family member's perspective.
Mhm.
So we need to tell families then, or do we, to be brutally honest and not hold, okay, which is difficult because you're talking to a stranger,
Yes.
right? Talking to the stranger from the government, right? So sometimes as families, it can be a little intimidating, but we need to, so as families, we need to be brutally honest. If there is a change, if a caregiver, say, caregiver is diagnosed with cancer, let's just say that, God forbid, or was in, some, so again, an accident, something very life altering. We need to be honest if there are behavior challenges and what those might be.
That
And
is
health. Okay, so
true.
medications, if someone's on multiple medications, et cetera. So, again, it's a little scary to open up your life like that, but in this situation, we need to, correct?
Absolutely, Rita. You can imagine. I've worked with families where I'll look at the needs assessment and talk to the navigator to get more information because it feels like there's more. And the navigators get annual training. We do that in person or, well, by video last year, but we do those. We have video trainings. We have all kinds of documents and practice they can do. But occasionally I'll get something, or I would get something, and I would review it and go, it feels like something's missing. And so, I'd call a family, or a family member would call me. And after another hour of discussion, I would hear, well, Jeff, my concern is my child sent me to the hospital with a broken bone last month, and I just don't know, it may happen again. We need that information. If we don't have that information for you, but we do for a different family, we're going to prioritize the other family. So please be as honest as you can about what's going on so that we can prioritize correctly. Because to me, that was the worst thing when we made this change. So before we had short-term planning list, which was what we felt were the highest acuity folks, and then long-term, which was much longer. Well, when we started doing these needs assessments for everyone, there were a lot of folks who were on the long-term planning list who absolutely moved forward right away because of information we didn't have before. And so we need as much as we can get.
Okay, and so someone is asking, are assessment tools available for families to see? Have the tools been validated and determined reliable? Thank you
Thanks.
for that question.
That's a great question. So again, it would be an open records request to get a copy of the forms, or you could go online and search determination of need revised and find that one. The determination of needs revised is a valid tool that's been validated. We have done some work on the validation of the set of the three together, but we haven't finished that work yet. What we're working on is comparing sorry, this may be more than he's asking, but we're trying to do concurrent validation with the CIS and HRST. Some real preliminary work showed a high level of consistency, actually more consistency between our needs assessment and the HRST and the CIS than the two have between each other, which is kind of exciting. Sorry, I do have a doctorate in psychology, and so that kind of testing is super exciting for me.
We hear your enthusiasm. Thank you. So for our folks on Facebook, I'm just going to put this in the comments. I don't know if you can see it. If you want me to give you a shout out, you have to give access to StreamYard. There's a couple folks. Thank you to the person that put the open records link there. So thank you. I can't acknowledge you, but thank you so much. Let's see. Is there anything in the waiver that would allow for families who need services, but the school system who did the initial diagnosis has destroyed records and for some reason or another cannot provide eligibility without those records? That's an interesting question. It sounds very challenging. Do you have anything to comment on that, Jeff?
Absolutely. So one, this is Kelly's lane because I'm not that kind of
Right.
psychologist, but yes, please reach out to us. Our intake team can make different suggestions of where you might be able to look. We have to be able to find some evidence of an intellectual disability prior to 18 or closely related developmental disability to occurring prior to 22. But for sure, reach out to the field office, complete the application, and we'll help where we can.
Thank you.
Kelly's the right person to go
So
to.
again, the back to this question, the assessment tools are not available for families to see at this time without an open records request. Did I get that right?
Right. Or
Okay.
if you want to look at the determination of need revised, Google it and it will come up. It'll have all the questions on there.
Okay. So I think I'm just looking back to see if did I miss any question here. Okay. Okay. All right. So we talked about the assessment, the assessors. The assessors receive training. What type of? And you said they receive training once a year, or
Yeah. So
yeah.
we have regularly scheduled annual trainings where the person who reviews them has always done our trainings for us. It is we do practices. We go through ones that have been completed. We check to see how other people are scoring so that we have internal consistency. Because prior to changing to this, each region had their own group of people and they would sit together and they'd talk. And so what that ended up being was whoever was able to advocate the best, this is at least consistent, right? And so, yeah, our internal consistency is reviewed to be sure everybody's doing them the same way. The region where this PLA supervisor, the lead, works, she reviews all of them from around the state. But even prior to that, we would send random ones to her to review to make sure that consistency was good. If we see things that don't add up when we're going through, then we'll talk to the navigator and get clarification. If we see inconsistent scoring, then we'll have that person redo the online training, review the scoring guidelines and all of those pieces. If there are still inconsistencies, we'll partner them up with one or two of our other navigators who have done this work for us since we started, but then did the same work at Division of Aging for 10 years before that to mentor them through the process if there are challenges.
So we have other questions here. So again, families, we want to be proactive. If we haven't heard, we're going to contact the region. We're going to be as honest as possible, even though it might feel a little bit intrusive in terms of the needs. Here, Sandy says, I'm assuming that a young adult aging out of school with parents who both need to work would move the individual up the list. Is that correct?
Absolutely. Yeah.
Okay.
Yeah, because now we have someone who doesn't have. I should rephrase it. It's based on the person, right? And so if your child is aging out of the school system and you and your spouse both work, but your child decides to go to work as well, they may not need support. But if they need that level of support, absolutely, it moves them up the list.
So,
Absolutely.
but again, this is an interesting question because it's based on the individual. So, if that individual can't stay alone at home, we want to say that. That's what we want to say,
Absolutely.
right? And so, yes, the parents need to work, but we need to say that that individual is not able to stay alone. Okay.
Right.
Okay.
Right.
Okay.
Well, and honestly, even if they were able to stay alone, honestly, that's not probably the best thing for them, right? Because
Right.
moving
Yeah.
from the school system to the couch, I like Price is Right, but that's not the best thing for folks, right? And so even if they could be home alone, we really are going to look at what's best for the family and the person. We may recommend
Okay.
some employment activities and things like that if there's an interest. But yeah, please give us that information if you can.
Here's another question from Rita. Hello, Rita. Hope you are well. If a parent retires, would that individual move up the list? So, in terms 65 parent caregiver is 65 plus. I'm assuming that's the what your age, Rita. Yeah.
Yeah, so your comment there is really telling, right? Because um, some folks are fortunate to retire at 40, and so simply retiring in and of itself would likely make someone's unmet needs lower if that meant that you're home more to support the person. However, we recognize, and I recognize this more every year, that as we age, we may not be capable of what we were 10 years ago or 15 years ago. And so we wouldn't look at the retirement piece, but we would look at the capacity to continue to care for your loved one as you age. So it's more related to aging and capacity than retiring.
Okay. Okay. Couple others here. So, Carol, I see you're asking about the region and phone number. If you'll scroll up a little bit more, someone had posted a link a little bit earlier. Um, let's see. Ron C. I'm not sure that this is in Jeff's lane, but I just want to bring this up. I was forced to pay out of pocket for psych eval as school records were destroyed. Required me to do this. Is that a question that's directed more towards Dr. Bishop? Okay. Okay.
I can say that we absolutely have to have that evidence in order to send it to Alliant, which is the third party
Accurate.
that
Okay.
validates eligibility. We do have to have evidence of some sort.
Okay. Let's see. Samara, I hope I said that right. Hampton, good info. My son is getting too big and too fast for me to keep up with him, and my husband works. Thank you for the comment. Even if a child works a few hours with a program, that doesn't mean they can be left alone and get back and forth and make safe
Completely agree.
choices. 100% agree. Yes, we would agree with that. Let me see others if I've missed here. Here's a hello, Philip. Thank you, Jeff. You've been one of the
Hey,
most
Philip.
helpful and empathetic members of DBHDD. Want to give out a shout out to Stacy Ramirez. Thank you, Stacy. Let's see. Are there any other questions folks have? So one of my last questions. I'm thinking about those folks that may fall in that most in need category. Here we go. This is a good one from Cindy. Does economic standing affect placement on the planning list? Are you able to answer that?
So, in a broad way, right, economic standing could affect placement on the planning list only because you may have more or less resources, which could impact the level of unmet need, right? So, if you're a single parent having to work two jobs, your loved one probably has far less support. If you're married and one spouse is able to provide for the family and the other is able to stay home, that person probably has fewer unmet needs. So in a broad sense, it could, but we do not look at, it's not something that we look at specifically.
Okay. All right. Any other questions, folks? So I'm thinking about those folks, let's say, that are in unique circumstances, are adults that are aging out of foster care. Would those folks be in a category that may, receive a waiver?
Yeah.
On a high, yeah.
So it's not because they're aging out of foster care, but it is because they're about to be homeless, right?
Okay, gotcha.
So
Okay.
if it wouldn't necessarily matter that they're coming out of foster care, except they really aren't going to have a home or anybody to support them anymore. So it would be the same as an unfortunate situation where both parents passed at the same time for an adult with developmental disabilities. There has to be someone there to support them. So yes, but it's not because of the foster care piece.
Okay. Okay. Um, Individuals with no family members, again, both family caregivers have passed. That would be
Yeah,
potentially
so
put someone, yeah.
potentially, right? So I had a conversation with someone who was advocating for someone because their family member had passed, but with more investigation, the family member had passed 5 years ago. This person had their own apartment, their own job, used public transit without any challenges. And so the fact that the parent had passed away 5 years ago, it really didn't impact things. So it's really based on the person and unmet need.
Okay. Other questions, folks? I think we're going to start wrapping this up. Let's see if folks have any questions. Thank you so much, Linda, for that comment. Okay, I don't know, Sarah, if we can answer this, but I am going to, let's see, I'm going to put this up. I don't know, but we'll see. Sarah says, my daughter's significant medical needs and gets 87 hours a week skilled nursing through GAP. How do we successfully transition from one waiver to another with no service interruptions? Is there anything you can say on that, Jeff?
Absolutely. And thank you so much for bringing this up, Sarah, because there are times when we do this extremely well and there's no interruption. And there are times where, frankly, we fail. And for folks who have significant medical needs, that is the last time that we need to fail. We need to get this right. And so reach out to us. Be sure that, and so this should come out in the annual needs assessment. Okay. But if for some reason it doesn't, please reach out to us within 6 months or longer of your child aging out of GAP services, because one of the challenges that's a little difficult to explain sometimes to families is now and comp waivers are payers of last resort. And so that means if there's some other funder who should cover that support, they have to. We can't do it. And so for a child with significant medical needs, once they're an adult, they may very well meet our most in need status and move forward into waiver services. And it sounds like a child with 87 hours would probably fit that. But what we can't do is say at 10 or 12, as long as GAP's covering, they have to by law. So sorry, reach out to us, please, to let us know well in advance.
Okay, and she says, every time I talk with DBHCD, they say we are already taken care of by other supports. So again, best to reach out, and you by reaching out, you mean to the
navigator,
navigator in the
on
region.
your response, it goes back to we're the payer of last resort. And so I understand that GAP may not be providing the support that you need, but we are absolutely not able to provide those services through now and comp waiver until your child ages out of GAP. Now, if there were other supports that your child needed, beyond personal support services, which we call CLS, because those also have to come through GAP if there's nursing. If there were other things that were needed and she met our most in need, we do have times where there's a GAP waiver and an hour comp waiver, both doing different things. But if it's for the medical piece or the personal supports piece, we're not able to provide those supports until your child ages out of GAP.
Naomi, I'm not sure if I get this question, but how does an individual with IDD and behavioral health needs, especially if the behaviors appear more prominent? Oh, yes, that is actually a good question. Can you speak to that? Yeah, so in terms of if the behavioral health needs are more prominent than the DD, does that impact the assessment?
So it should not impact, well, it would create a higher level of unmet need, right? And so we'll measure that regardless of why there's a higher level of unmet need. If I have high cholesterol, which thankfully I don't, I just got back from the doctor last week, but if I had high cholesterol and I went to the hospital because of a broken leg, I wouldn't expect them to treat my cholesterol, right? I would expect them to treat my broken leg. And so even though you might have a higher level of unmet need, we would also look at, are the services that we're able to provide through the Division of Developmental Disability going to be able to impact whatever is causing that? And what we've done in the past in these situations is make a referral to the behavioral health side and try to connect folks with counseling, with peer support groups as appropriate, right? So if those things weren't appropriate for the person, then we wouldn't. But we try to match the support with whatever the challenge is.
And it is challenging when we have individuals with co-occurring conditions. So I appreciate you answering that. Thank you to Thomas, who's saying you're a provider. Thank you for watching. This has been amazing. I appreciate that positive comment and shout out. Let's see. Okay. Um, Again, not sure if we can answer that. Let's see here. Okay, folks, if you have a question, please repeat it. Oh, here's another one. Jeff, I don't know if you can answer this. Can you get GAP and comp? Can you receive it concurrently?
Absolutely.
Okay.
You can. What we can't do is provide the nursing or personal supports through comp waiver that have to come from GAP. So say you have a need for community access or employment, now or comp waiver can provide those services, that support, but we can't provide what GAP has to provide. It's the same with behavioral services. So if you're eligible for the Autism State Benefit Plan, the behavioral services must come through there before they could come from us.
Okay. Okay. That's also good to know. Okay. I think I don't see any other questions, folks. If you had a question that is burning, I may have missed it here. Okay. That would be pertinent to Jeff. Let's see here. Anything else, folks? Okay. All right. So, Jeff, is there anything else that we need to cover? And we missed Tawanda. I'm sure she was in a meeting that, maybe, ran too long, et cetera. So please tell her we missed her. And I'm hoping she'll be able to watch. And she is in the position that you formerly had, correct?
Right. So we've changed the title to Assistant Director of Field Operations, and she is responsible for planning list administrators, and that whole team, which I have to say is a great team, and I miss them very much.
Well, again, thank you, Jeff. Thank you for everyone, to everyone for watching on Facebook and on YouTube. Again, I have a private Facebook group if you'd like to join that, Real Talk with Rita, or you can always watch here on YouTube as well. Thank you all so much. And Jeff, thank you very much. Appreciate all the work that you're doing to help our families. And I hope this has been helpful to everyone. Have a wonderful weekend, everyone, and you take good care. Goodbye.
Bye. Thank you for the opportunity.